In this video, I'm going to shine the light on 4 traps you will likely face in your C&P exams. I'm going to cover how I identified these traps and how you can too, and exactly what I did to overcome them to get 100% P&T with SMC in only 4.5 months. I'm going to cover the 5-minute expert examiner trap. They haven't even looked at your file, and guess who's going to pay the price? The make a good impression trap. In this case, if you fall for this one, your appointment is sunk from the jump. The skeletons in your closet trap. The examiner goes and gets stuck on digging up bones. And the bait to exaggerate trap. In this case, they can write off the entire exam if you fall for this, and potentially your entire claim. So please watch all the way to the end. Number 4 is absolutely nasty, and I really want you to hear about it. If you haven't had a chance to subscribe, please hit that subscribe button and consider liking this video, sharing it, and if you could drop me a comment, I would love to hear from you. I have replied to 100% of the comments, and it's been the absolute joy of starting this channel is getting to hear from so many of you out there. Number 1, don't fall for the 5-minute expert examiner trap. It starts off with questions like this. Now let's see, you were in the Air Force, correct? I actually had this happen to me, and it doesn't mean that if you were in the Air Force, it's wrong. It just means it's not my branch of service, which means they have no idea who I am. Or what are we here to go over today? Let's see, what condition? Or I haven't had a chance to review your records yet. I'll be doing that after the appointment. Now, a vet just left the office. There's 8 more behind me in the waiting room. And you mean to tell me you haven't looked at my records yet, but you're going to do it after this appointment? Yeah, right. So here's the trap. They will document my appointment or your appointment as a 5-minute expert with no understanding of my claim file, not looking at my evidence, no context of my medical history, and many times not that familiar with the condition being examined medically. The examiner is hurrying through the exam and minimizing my condition. Here's what's going to happen if we fall for this trap. The DBQ, the questionnaire they use to fill out the results of this exam, will likely not be filled out correctly or filled out completely, and it's going to come back from the rater because the rater doesn't have enough information to even make a decision. Can you imagine an examiner that didn't take the time to do any preparation for your exam, sending an inaccurate or incomplete questionnaire to the rater? It comes back to the examiner 30, 45, 60 days later, and they're going to have to try to remember you and a specific question about your condition. Yeah, right. So here's what we need to happen. I need my condition properly documented on this DBQ. I need it filled out completely and correctly, including my in-service event, injury or illness, the severity and all of that, so that they can check at least as likely as not caused by service, so I can get the rating I've earned. Here's what you can do to overcome it. You have to know the DBQ. I'll drop the link where all the DBQs live online. And you need to know what they need to document. And so number 2, bring hard copies of your medical records of your diagnosis. I brought my medication in a Ziploc bag and basically handed it to them for the various conditions. So in this case, you basically have to take over this exam in a humble and respectful way, but you have to keep pushing for what happened before service, the in-service event, and then how bad it's been ever since in an honest and truthful manner so that they can document that in the report. Some things you can say are, can I share with you how this happened? Would you mind if I share with you how bad it's been ever since? Number 2. The make a good impression trap. Here's some questions to look out for on this one. The examiner walks in the room. What a wonderful day. How are we doing today, veteran such and such? Doing good today, sir? Maybe comments like, I love going to Disney World. Doesn't it just light up your day? Don't you just feel magical when you're there? Here's the trap. The examiner comes in with a Mary Poppins greeting and real high energy and throws in some magical emotions, And it can take advantage of you wanting to get off on the right foot. So you, the veteran, try to match their energy, match their expressions to try to build trust and credibility. In the end, here's what they're going to do. They're going to document veteran presented in no acute distress, or worse, no objective signs of impairment, be it mental health, back pain, knee pain, anything. Here's what you need to happen. We do want to start off on the right foot, but all I need to do is establish trust and credibility with this examiner so they will accurately record my condition on this form. I don't need to match their energy level or their excitement or their terminology. If I reported major depression and the examiner sees me jump up, glad hand them with a handshake and return a big, huge smile, instead of establishing credibility, I've actually just lost credibility, because if they did look at my file, it doesn't match with what happened. And so immediately I'm in trouble in this exam. So what do you need to do? You need to understand as a veteran that the greeting is not a compliment, it's data collection. And you need to understand the questions on your feelings and your emotions are not idle chatter. It's data collection to be and can be used to deny your claim. Treat this exam as a deposition, not a job interview. Your responses verbally and non-verbally are being recorded in some way or another and will be reviewed by a VA rater and may be needed later in the case of an appeal, a higher level review, or even a legal review as evidence. So here's what you can do. To the question, aren't we doing good today? Try saying this: I'm doing as good as I can be under my current condition. If they say something like, isn't Disney World magical? Try something like this if it's accurate for your condition. I'm sure it is to those who aren't struggling with what I'm struggling with. Try something like that, and don't fall into the trap of trying to make a good impression. It's all about trust and credibility. Number 3, the skeletons in your closet trap. Questions to look out for this one. Did you ever have anxiety or feel depressed when you were a teenager? Or did you ever have any injuries in Little League Baseball or middle school football? And here's a key phrase to look out for. Tell me more about, and it's not your in-service event, it's not your current conditions, it's all about the past. Tell me a little bit more about your parents' relationship. Tell me more about your school experiences. Did you ever get in any trouble at school? Did you ever get in any trouble with the law prior to military? The trap here is the examiner is digging into pre-military service past to try to find a non-service related cause for your current condition so they can blame that on your current condition. And in the end, they could put something like this: the claim condition likely existed prior to military service. And guess what that means when it gets to the rater? You guessed it, denied. Now, a question or two about prior military, your life prior to the military in relation to a certain condition is fine. We actually need them to know that we were fine before the military service, if indeed that is the truth and the case. But this is when they go to digging and they keep asking and they won't get on to the in-service event. That's when it goes to digging up bones, and that's a trap. So what do we need to happen? I need my in-service event that absolutely, truthfully caused my current disability, confirmed in this exam, understood and documented, and as well as my symptoms and severities and frequencies. And I need them to say, like the others, at least as likely as not, or we hope more likely than not, caused by military service, and that's sent to the rater for the review of my claim. So what can you do if you encounter an examiner that's digging up bones? What you can do is keep your answers centered on military service and point the examiner back to military service. They're getting off track. You only have 20 minutes. I think the longest C&P exam I had was 20 minutes. Okay, so I don't have 15 minutes to talk about my past life. So what I've got to do is get them back on track. Try statements like this. My symptoms, look, sir, ma'am, my symptoms began during active duty. Here's what triggered it. Or, whatever I had prior to military service didn't require or rise to the level to require any medical intervention or mental health assistance. I would just consider it the everyday events of life. Or you could, if they keep pushing, you could try this. I didn't have these symptoms before I served. Can I tell you about when it started for me? Try that if you fall into, or if it looks like you may be falling into a skeletons in your closet trap. And number 4, bait to exaggerate. The formal word is malingering. Malingering means to exaggerate, to fake. And psychologists and even the other examiners in other conditions are trained to spot malingering. But in some cases, I have found they're trying to bait you to malinger. You can spot that by questions like this. So I see you reported having issues with being around a lot of people. I noticed they opened a new mall in your area. Would you recommend it? I know you said you rarely see your kids, and the military services cause social and family relationship impairments. But do they live nearby? And if so, you probably see them more than you thought. And then you, wanting to please the examiner, may say, well, now that you mention it, I actually do see him a little more than I thought. And you're excited because the examiner looks very happy with your response, but the reason they're happy is you've taken the bait and fallen into the trap. And what is the trap? It's often questions early on compared to questions later in the interview asked slightly different. Or they could be comparing your response during this exam to what is in your claim file. And if they find you exaggerating, you've reported multiple times, and maybe the beginning of the exam it happens monthly, once a month, but now in the exam you're saying it happens daily, they're going to get you on malingering, exaggerating, or contradicting yourself. What they could end up writing in your file is this: presentation inconsistent with clinical findings, possible malingering behavior. Or veteran statement inconsistent with self-reported history. Here's what we need to happen. I need my symptoms, severity, frequency to be captured and documented as they really are, so I can get the rating I earned and deserved, as we've been saying. So what can you do in this situation where you feel you're being baited to exaggerate or contradict? Here's what I can do. The best advice is I have to know my condition and what I have already reported in my claim file. Also, pay attention to how you're responding during this exam. So when you get to minute 15, you need to be remembering in the back of your mind how you answered a similar question in the first few minutes of the exam. Stick to the truth and you'll be fine. Well, those are 4 of the most common C&P exam traps that I've run across, and I hope that this video has been beneficial to you. Would you please consider subscribing to my new channel and helping me get this off the ground? Also, if you found this video helpful, would you consider liking it, sharing it with anyone that may benefit from it? And also, feel free to drop me a comment. I'd love to hear from all of the viewers. And if you feel comfortable, I'd love to hear what state or country you're from. I find that really interesting to know where the viewers are out there. And if you want more information on the full C&P exam process and how to absolutely crush the C&P exams the first time to get the maximum rating you earn and deserve, I'm going to put a link to that up on the screen for you to follow. So thanks so much, and I'll see you on the next video.